Good evening all. I'm Aditi Lamba with the Thurs night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 219 million cases of COVID-19 with more than 4.5 million deaths. Here in the United States, we are at more than 44 million cases of COVID-19 and we have surpassed 708,000 deaths. Today, Pfizer has said that it has asked US regulators to authorize emergency use of their COVID-19 vaccine for children ages 5 to 11, a group for whom no shot is currently allowed. The US FDA has set a date of October 26 for its panel of outside advisors to meet and discuss this application. This will make it possible for around 28 million children to begin receiving COVID-19 vaccine shots. A rapid authorization here for this age group of children could help mitigate a potential surge of cases in the coming weeks and months, with schools opening up nationwide and colder weather driving activities indoors. This vaccine could be ready for rollout as early as November. With this, let's now take a look at the headlines coming in tonight with our exclusive with New Jersey Governor Phil Murphy. Here are the headlines. ITV Gold exclusive featuring New Jersey Governor Phil Murphy. World Vegan Vision celebrates Gandhi Jayanti 2021, New Jersey. Annual Breast Cancer Awareness Month kickoff, Hackensack University Medical Center, New Jersey. It's time for a short break on Vision of Asia South Asian News segment. Don't go anywhere, we'll be right back. And welcome back. I'm Aditi Lamba and this is Vision of Asia, Thursday night episode of South Asian News. This month of October is observed as the National Breast Cancer Awareness Month, a leading cause of death in South Asian women. An estimated 1 in 8 women will develop breast cancer. This National Awareness Month provides an annual opportunity to educate the community on breast cancer advocacy, research, and patient care. Throughout this month, major breast cancer charities raise funds for research into cause, prevention, diagnosis, treatment, and cure. On this recently, Hackensack University Medical Center in New Jersey held an annual Breast Cancer Awareness Month kickoff outside the University Medical Plaza. The event provided insight from experts on breast cancer along with breast cancer survivors and gave advice for women to prevent breast cancer or catch it at an early stage. Here are some highlights from Hackensack's kickoff event for breast cancer awareness.
So today is October 1st and we are involved in the kickoff for Breast Awareness Month. The whole month of October is filled with activities surrounding breast health, breast wellness, and breast cancer. Mammography is the best test for screening for malignancy of the breast. It is a standard of care and we recommend mammography at age 40 for all women annually. Mammography screening is the best way to detect cancers early and the best opportunity for a cure, and at the same time to minimize treatments necessary for women with breast cancer. All women starting at age 40 should have annual screening mammography. The biggest risk factor for breast cancer is being a woman and getting older. Some women are eligible for screening earlier. If they are at high risk, screening should become annual earlier than age 40, sometimes at 35, sometimes at 30, depending upon your risk factors. So please speak to your doctor and consider getting a high-risk assessment with one of our breast specialists. Mammography doesn't prevent breast cancer, but it is early detection, and early detection is what saves lives. So we've had some significant advances in breast imaging over recent years. 3D mammography is a significant improvement over 2D mammography because we are able to decrease the number of callbacks for patients. In other words, fewer patients have to come back for additional imaging, but at the same time, we're able to detect more cancers. 3D imaging allows us to see things that might be hidden by overlapping tissue and therefore finding things earlier and improving prognosis and hopes for cure. We all know people who have breast cancer. It's very, very common, but the good news is with early detection, it is very treatable. And now with improved treatments, the treatments seem to be less significant. In other words, patients have much fewer side effects and survive treatment with a long life ahead of them. Lots of people don't come for mammography because they say, nobody in my family has breast cancer, and they think that they're not at risk. But just by being a woman and getting older, you are at risk. So everybody should come for their annual mammogram. It doesn't hurt. The radiation dose is exceedingly low. In fact, just to compare for you, the radiation from a mammogram is less than the radiation that you might get from a transcontinental flight from New York to LA, and nobody ever really thinks about the radiation exposure when they get in an airplane to go on vacation. So the risks are exceedingly low and the benefit very high. And just remember, it does matter where you go for your mammogram. You want to go to a facility where there are well-trained mammographers. Those are the physicians that read your mammogram. You want to go to a facility where the equipment is state-of-the-art, preferably 3D imaging, and you want to go to a facility that has other modalities like surgery and pathology and oncology, that should you need those services, they're all available under one roof in a collaborative approach. So where you go may save your life. Be your own advocate. Get your mammogram.
My message to most female is mammography is the early detection to, find out breast cancer at a very early stage. The earlier you detect, the more chances of survival. It's very important for all women, including Asian Indian women, to make sure they get their mammograms and talk to your friends about it. The earlier you get this detected, the better the chances of survival. Most of us females hear about the word mammogram and we get scared. We are afraid of the compression and we are afraid of how it's going to get to you. The most important thing I want to tell you is, yes, compression is necessary for a mammogram, but the compression is less than 30 seconds and you need that in order to get to the finest of the cancers, in order to detect it at a very early stage. If you do not compress good, the pictures are not good and it would not serve the purpose of a good mammogram. And I would request all women not to get scared of having their mammogram, but go ahead and have it done.
This month commemorates the 152nd birth anniversary of India's father of nation, Mahatma Gandhi. Known as Gandhi Jayanti, his birth anniversary across the world is marked as International Day of Nonviolence to pay tribute to Mahatma Gandhi's principle of nonviolence, truth, and perseverance, which is relevant in the world even now. Marking this birth anniversary, recently, World Vegan Vision hosted a celebration for Gandhi Jayanti in New Jersey. World Vegan Vision promotes and increases the public awareness about three main aspects of veganism: health, animal welfare, and environmental conservation. The mission of World Vegan Vision is accomplished through grassroots activism, outreach, social activities, fundraising, and education. Here are some highlights from Gandhi Jayanti celebrations hosted by World Vegan Vision.
So Gandhi Jayanti is observed annually every year to commemorate the birth anniversary of our great Indian freedom fighter Mahatma Gandhi. His full name is Mohandas Karamchand Gandhi and we fondly call him Bapu too. He was given the title of Father of the Nation by Netaji Subhash Chandra Bose for his relentless struggle for India's independence. This day is observed on October 2nd every year for his invaluable contribution for India's freedom. Gandhi Jayanti is a national holiday in India, and also United Nations celebrate this day as International Day of Non-Violence every year. So Mahatma Gandhi was born in Porbandar, Gujarat on October 2nd, 1869. He was only 24 when he travelled to South Africa to pursue law, and where he saw for the first time for inequality and injustice due to his race and colour. The incident tells us that he was thrown out of the train because his colour was not as compared to his fellow passengers. At that time, the sense of justice prevailed in him, and when he went back to India to practice law, he was very disturbed with the injustice all around. He always fought for what is right, and he took part in many He took part in various civil rights movements. He launched India independence movement with Satyagrah and Quit India movement, which were very famous. His dedication forced British to flee our country and make us independent. So India got independence on August 15, 1947. Unfortunately, Gandhiji could not be with us for long, and his samadhi is now located in Rajkot, Gujarat. He was a man of true truthfulness, peace and non-violence. So what we can do is we can inculcate those values in our life and live a peaceful life with the concept of non-violence. Thank you. Jai Hind, Jai Bharat.
Guruji, Dr. Shah, Dr. Sudhir, Parikh, Mrs. Parikh, Chandrakant Bhai, Dilip Bhai Patel, and all our friends, family, વડીલો એમના ભૂલકાઓ આજે જે મને જે અહીંયા મોકો આપ્યો છે એની ખૂબ જ આભારી છું. થેન્ક યુ ચંદ્રકાંતભાઈ એન્ડ દિલીપભાઈ.
We are running out of time, so all invited guests and respected all older people. Today we are here to celebrate Gandhi Jayanti, organized by World Vegan Organization. World Vegan Organization, I would say HKG is the Gandhi of World Vegan Organization.
That's true.
He and his team is really working hard, wonderful job, and maybe in few years, whole New Jersey going to be vegan or vegetarian. So I really wish and I congratulations to all HKG's team. If I started to give name, it's too long and I don't have a time. But if we can in these two occasions, Gandhi Jayanti and celebrated by World Vegan, if we can only one or two, his Gandhiji's Siddhant, what is principle. If we can use only one or two, our life going to be changed. And if we are going to be a vegan, our life going to be changed too. So thank you very much for inviting me, and thank you again.
Shukriya. Thank you very much for inviting me and giving me an opportunity. આજે જેટલા પણ આપણા સિનિયર્સ અહીંયા આવ્યા છે, સૌથી પહેલાં તો હું એમને નમ્ર વિનંતીથી પગે લાગું છું કે આજે ઘણી પહેલી વાર તમે બહાર નીકળ્યા છો 1.5 વર્ષ પછી, અને આઈ એમ સો ગ્લેડ કે તમને બધાને એકસાથે જોઈને, અને એમાં પણ આજે આપણે ગાંધીજી જયંતિના એવા પ્રસંગે ઊભા થયા છીએ અને મળ્યા છીએ આજે. તો ગાંધીજીના जो भी गांधी जी की सोच थी, उन सोच के साथ अगर हम लाइफ में एक और दो चीज़ अपना लें, जिसमें से एक चीज़ हमारे साथ आज मिली हुई है वो है vegan food. So if we go for vegan food, हमारी हेल्थ में जो हम सीनियर होंगे तब भी हमें मेडिसिन से दूर रहना पड़ेगा. कोई मेडिसिन लेने की ज़रूरत नहीं पड़ेगी, कोई डॉक्टर की विज़िट भी कम हो जाएगी. कुछ तो रहती है पर बहुत कम हो सकती है. तो देयर इज़ अ टू कॉज राइट नाउ. आई डोंट वांट टेक मच टाइम. गांधी जी में से आज अगर हम वीगन लेके यहाँ से जाते हैं कॉन्सेप्ट, वो वीगन क्या है, वेजिटेरियन एंड वीगन, डिफरेंस बिटवीन दैट, अपने घर में भी उनको बोलना और अपने पास में जो भी आता है उनको भी वीगन के बारे में बताना, ताकि उनको भी, उनकी भी हेल्थ, जैसे हम कोरोना में सीख चुके हैं कि हम अकेले नहीं जीते हैं, हम कम्युनिटी में जीते हैं, इसलिए हम मास्क लेके घूमते हैं. तो वो चीज़ की तरह ये वीगन फूड भी वही है. अगर अपने कम्युनिटी, अपने घर वालों को आप बचाना चाहते हो, दवाओं से हेल्दी जीने चाहते हो, तो प्लीज़ गेट देम टू द वीगन फूड. Thank you very much.
Namaskar and Jai Hind. First of all, I would like to express my heartfelt gratitude to World Vegan Vision for organizing this wonderful event. And I would like to reiterate the message that all the speakers who spoke before me delivered here, that veganism is something that is very deeply linked with the idea of ahimsa, with the idea of non-violence. And what better occasion to celebrate this association than the eve of Gandhi Jayanti, which is today. And tomorrow we are going to celebrate Gandhi Jayanti all over the world, when the world remembers the ideals and the, you can say, the revolution that was brought in by Mahatma Gandhi. So once again, I would like to thank World Vegan Vision and all the enthusiastic participants who came here today and made this event a success. And I wish all the best to World Vegan Vision and their movement. Thank
Well, it's now time for another short break on Vision of Asia, Voice of the Community. Again, don't go anywhere. We'll be right back. And welcome back. I'm Aditi Lamba and this is Vision of Asia South Asian News segment. We have now an ITV Gold exclusive with New Jersey Governor Phil Murphy on COVID-19 vaccines, the economy, women's reproductive rights, and more. A proud Democrat, Governor Phil Murphy is up for re-election for his second term in this coming November 2nd's gubernatorial race. This election will help determine New Jersey's trifecta status for the next 2 years. Governor Murphy is running on the issues of affordable housing, clean energy, COVID-19 response, criminal justice reform, education, economy, gun safety, voting rights, and much more. In our conversation with the governor, he reflected upon his frustration over people choosing not to get vaccinated due to misinformation and said that mask and vaccine mandates have been implemented across the state for safety and health of all New Jerseyans, especially the children. Governor Murphy also stressed the importance of getting a booster dose, a third dose of the COVID-19 vaccine, as the next step into bringing some sense of normalcy back to New Jersey. Here is our exclusive conversation with New Jersey Governor Phil Murphy addressing the South Asian community on ITV Gold. Here is Governor Murphy. About what's happening with COVID-19 crisis, Governor. Obviously, we're seeing a rise in cases across the nation, and New Jersey also is seeing a certain amount of rise in cases. My first question to you has to be, are you disappointed in New Jerseyans that are deciding not to get vaccinated? And what is being done for that community of people to get them to get vaccinated?
Yeah, again, it's good to be back with you. There are two types of people, Aditi, that are not vaccinated. One group I'm very frustrated with. They are saying and or believing complete myths about the vaccine and its safety. But there's another block of people, for a variety of reasons, who are not vaccinated, who have legitimate reasons. They may not speak English. They work 2 or 3 jobs. They think that the vaccine will out their immigration status. They've been told it costs a lot of money, a variety of reasons. I'm deeply disappointed with the first group, but with the second group, we are doggedly going door to door in many communities, still getting people vaccinated. New Jersey has among, if not the highest rate of vaccination of any state in America, certainly of any big state. And we should all be proud of that. Folks have, by the millions, done the right thing. So the overwhelming majority of folks in our state have done exactly what they should be doing, and they should be recognized for that.
Governor, how concerned or worried are you about spikes that could happen in the fall and winter? Because right now things remain still okay in the Northeast, but are you worried it may get out of hand?
Yeah, I mean, you have to have concern with this pandemic. Every time you think you've figured it out, it takes a turn, and it's very humbling. Having said that, I wouldn't trade our state with any other state. As I mentioned, our rate of vaccination, we have the smallest percentage of ICU beds occupied by COVID patients of any state in America. Do I think when we begin to live our lives predominantly indoors, will this bump up again? I fear it will, but I also would say that I don't think it will come close based on everything we know to impairing or threatening the capacities in our healthcare systems. I also would recommend everybody, if you're eligible for a booster, go out and get that booster shot, because that's even more protection against the virus.
Yeah, quite interesting enough, my mom got her booster shot just yesterday, and I'm very grateful for it because she is at high risk. You know, just talking about COVID-19 in general, Governor Murphy, I have to ask you, when you are looking back at all the work that's been done by your administration in the last 1.5 years and more, almost 2 years of this pandemic, what could you have done better? What would you have done differently had you known more details, had you known what was needed for the community? What's your take on that?
I don't think there are steps that we would have done differently per se, but I was very frustrated with then President Trump. You may recall this in a book that he was being interviewed for by Bob Woodward, I believe, who admitted that they knew this was an airborne virus, and secondly, they knew a lot more about how lethal it was before they let on to the rest of the country. Had we known that, we would probably have taken the same steps, but we would have taken them much sooner, and we would have saved lives as a result of that. I also bemoan still the fact that President Trump made the wearing of one of these a political battlefield, which it never should have been. And that has also sadly cost health and lives as a result.
Would you say New Jersey right now is more prepared to handle another big outbreak of pandemic if that happens?
There's no question. I would say more prepared certainly than we were at the beginning. There was no playbook at the beginning.
Right.
And I would say we're as prepared as any American state without question. So the answer is yes to both.
Let's talk about mandates, Governor, because a lot has been said about it nationally, a lot is being said about it internationally as well. My first question to you on that has to be, what made you decide to enforce or implement these vaccine mandates across the state, especially for school staff? What was the biggest factor that pushed you to do that?
Well, the factor is a simple one. Regardless of whether or not it's a popular decision or not, you make the decision based on the science and the data and the facts. And the overwhelming evidence is that these vaccines are safe and they work, period. Secondly, masking. It brings me no joy to have everybody inside of a school building wearing a mask, but the evidence is overwhelming that that is a very smart public health move, particularly with this Delta variant still in our midst. And by the way, let's remember kids under the age of 12 do not have any vaccine available yet to them. So the combination of those steps, we believe, keeps our school reality as safe as possible. Remember, the mandates include a testing option. So I want everybody to get vaccinated who's eligible. But if for whatever reason they're not vaccinated, we make them test up to multiple times a week. We think that package of steps, that layered approach in combination, will keep our schools safe.
With this, we wrap up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well. Bye.